It is the 1 year anniversary of the January 6th Trump riots. We are going to have a little bit of coverage of that later today. We're also going to carry on tomorrow's show. We'll have some clips from Joe Biden's statement, his speech today about that 1 year anniversary, very heavily placing a lot of the blame on Donald Trump, did Joe Biden today. But we'll talk about that later and tomorrow. There is so much else to get to, and I'm going to jump right into it. As many of you know, any opportunity that I have to clear up confusion or misinformation, disinformation, propaganda, or bad math and statistics, those are opportunities that I relish. And unfortunately, the opportunity we have today is to look at a clip from Republican Senator Rand Paul, who, to some people, very convincingly made an argument yesterday, not only against vaccine mandates, but against vaccines at all when it comes to coronavirus. And so we're going to look at this clip. There's a bunch of different concepts here that are relevant and that are important. So I'm going to be making notes of each of the aspects of what he says that need to be discussed. See if you can pick out the fallacious claims, and then we're going to talk about it in more detail. Let's take a look.
And so what we're dealing with is now a different disease, and it needs to be treated differently. We need to get rid of the hysteria. But the people who are promoting the hysteria work for the government. I mean, this is Dr. Fauci's fault largely.
It's the worst.
Because he's still hysterically talking about mandates and shutting people down and not letting people fly and blaming the unvaccinated. Everybody's getting this, vaccinated, unvaccinated. In fact, the majority of the people in the hospital now are vaccinated because almost everybody's been vaccinated.
Now, that is a lot of disinformation, but there's one really funny thing. At the end of what Rand Paul says, he actually gets to something that's really important in understanding the effectiveness and efficacy of vaccines, which is he says, because almost everyone is vaccinated. Now, that's not actually true. In the United States, we have a pathetically, embarrassingly low vaccination rate relative to so many other countries, specifically because of Republicans and Trump supporters who have one of the lowest vaccination rates in any country that has widespread access to vaccines. You can look at countries that don't yet have widespread access to vaccines and say, well, they have lower rates than Republicans. Yes, but they have no access to vaccines. Among groups, so if you look at, Spanish right wingers and, whatever group you want, American Republicans are arguably, and I think probably undoubtedly, although right up there, the least vaccinated group among any group in countries with widespread vaccine access, and by far the most unvaccinated group in the United States. But Rand Paul gets to something really important. In a country where everyone is vaccinated, everybody with COVID would be vaccinated. That doesn't really tell you anything about how good the vaccines are at preventing illness at all, preventing symptomatic illness, preventing serious illness, hospitalization, or death. I mean, think about that. No vaccine is 100%. And thus, the more vaccinated a country is, the higher number of people who are vaccinated that are going to get that disease. It doesn't actually tell you how much better off you are being vaccinated than not. If you get to 100% vaccinated, every case will be in a vaccinated person. What we need to be looking at are the outcomes and the relative risk. Imagine a country with 99% vaccination and 90% of the hospitalizations are in that 1% that's not vaccinated. Even though you have this high level of vaccination, you would still say you're way better off vaccinated than unvaccinated. So let's look at some data along those lines. When we look at, we can look at a bunch of different places. Let's start with Kentucky. You look at hospitalizations in Kentucky as of yesterday, okay? 45 inpatient hospitalizations. 76% were unvaccinated, whereas 24% were vaccinated. Even though the majority of Kentucky residents are vaccinated, 3/4 of those in the hospital did not have the vaccine. The relative risk of being unvaccinated is significant. Okay. You look at critical care and ICU patients, 11 of them, 100% of them are unvaccinated. So even though Rand Paul might look and say most people are vaccinated and the numbers are going crazy, look at the 11 people in an ICU. I think this is admitted yesterday. 100% of them are unvaccinated. And if you look at the 6 patients that are on ventilators, none of those people are vaccinated. This is what we're hearing anecdotally from emergency room doctors. The people with 3 vaccines are having very mild illness and don't need to be in the hospital, generally speaking. There's obviously exceptions to everything. Let's look next at, whoa, that's a picture of me. Don't know where that came from. Let's look at Ontario. In Ontario, you have 3 charts here. I'll describe them for people that are not watching, that are just listening today. If you look at cases are going up among everybody. Now, these are per capita. So this is important to understand. This is per capita. The leftmost graph, COVID cases, you see that the rate among the unvaccinated is significantly higher than among those with at least 2 doses. It's going up for everybody because Omicron is so contagious. Now, look at who's in the hospital. The gap between unvaccinated and vaccinated in the hospital is incredible. In Ontario, among the unvaccinated, the hospitalization rate is about 550 per million inhabitants, whereas the rate among the vaccinated is only about 100. You have a 5.5 times higher rate of being in the hospital if you're unvaccinated. And then if you look at ICU, the numbers are even more stunning. ICU occupancy among unvaccinated people is about 140 per million. It's only about 10 for those who are vaccinated. So that puts you 14 times higher risk of ending up in the ICU if you are not vaccinated. Last illustration here is from New York City. Looking at New York City here, you see this is just cases. Cases are going up for everybody, but the purple line is cases per 100,000. Among the unvaccinated, it's about 5,500 per 100,000. Cases among the vaccinated are about 300, okay? 15x or so higher. So Rand Paul is mathematically correct in that increasingly, as more people get vaccinated, more and more of the cases will be among the vaccinated. That's just simple math. It's base rates. But the rate of hospitalization, intubation, and death continues to be dramatically higher among those who have not been vaccinated. This is wide. This is around the world. There's no country in which this is not being observed. So very dangerous disinformation from Rand Paul, which a lot of these Fox News viewer sycophant types grasp onto for dear life and uncritically repeat. Understand the math. Very, very important. One of our sponsors is called Privacy. Privacy is a totally free service that I've been using for years. Privacy lets me create virtual payment cards with one click. And when I use the virtual card, the money is taken out of my bank account. You can create multiple cards, delete them, freeze them, set a spending limit on them. Let's say I'm signing up for a free trial and it requires a credit card. Privacy will autofill a virtual card number. And then after signing up, I can delete that virtual card. So I know I'm not going to be charged again. Something really useful and very practical. Or let's say I'm ordering food over the phone, but I left my wallet somewhere. I don't have my real credit card on me. I can use a virtual card on my Privacy mobile app. But really the best part is you're not out there exposing your real credit card number, so you're not as susceptible to data breaches and identity theft. Privacy is a totally free service, and you'll get $5 to spend when you go to privacy.com/Pacman. The link is right underneath this video.